Talking about the United States, we're going over there now. And we're going over to Michael Serres, who is Chief Executive of 11 Health. And he's presenting a view from both the patient and the SME, a small and medium enterprise sector, a really interesting combination that I'm keen to hear about. And Michael is going to be asking the question, to which I think there's probably a very simple one-word answer. But the question is, are patients the greatest underutilised resource? Michael, are you there?
Hello?
Hello? Are you there, Michael?
I'm here. Can you hear me all right?
Yes, we can, Michael. Thank you very much for joining us. What time is it where you are?
It is now 2:38 in the morning.
Michael, thank you for staying up, and my apologies for us being about 15 minutes late. I've already introduced you and the question you've posed. So, Michael, over to you.
Thank you very much, and apologise if I look half asleep to all of you. It's probably just as well it's on video. So, just a brief background about myself. October the 8th, 2011, I became the 11th patient to undergo a rare intestinal transplant at the Churchill Hospital in Oxford. My health journey started about 30 years earlier when I was diagnosed at 12 with Crohn's disease, the incurable bowel condition, and after transplant, I'm now a surviving two-time cancer patient. But my sort of world into technology started many years ago, but behind it all is actually underpinned by a conversation that I had as a 16-year-old that really I think remains true today, particularly as we start talking more and more about digital tools. I was privileged as a 16-year-old to be introduced to a gastroenterologist who ended up being the Queen's physician. And my parents took me in to see him and just said to me, whatever you do, behave. This guy is the best, just behave. And I walked in, and the first thing he did was send my parents out the room, and I was absolutely scared stiff. But he sat me down and he said to me, Michael, he said, look, you're on one condition, and that condition is that we do this together. You take as much responsibility for your care as I will. I'm going to teach you, but this is a partnership and this is a team effort. And that human to human relationship, I think, underpins healthcare and is even more important as we move into the world of technology. And I wanted to mention it because it's a theme that runs through a few things that I'm going to share with you. Because that relationship, again, reared its head when I went to Oxford to meet my surgeon for the first time. I was number 11, as I mentioned to you, and 5 of the first 10 patients had sadly not made it. And so it was a pretty scary experience for myself and my wife. But my surgeon walked into typical NHS waiting room. There were 5 of us in the room, 2 chairs and only 3 legs on the desk, and 8 lever arch files of my notes on the side. And the surgeon didn't open one of the pages of the files. He took a notepad off the top and he drew what my intestine looked like then and what it could look like after surgery. And in those 2 or 3 minutes, we built that personal connection and that relationship that really has gone on to really underpin how we now communicate, because that surgeon is now no longer in the NHS. He's head of transplant surgery at the Apollo Hospital Group in Chennai in India, and we communicate every day via WhatsApp about my condition. In the build up to my transplant, I started a blog, and blogging at the time 5 years ago was relatively new. It was just about keeping friends and family aware of what's going on. As I look back on that blog now, I realized a number of things happened on my own health journey. Is first of all, my transplant team read it and continued to read it to really get inside my mind. What was it like being a patient going through something where there was a 50-50? And I'm in Silicon Valley, you'd think it would work perfectly. So apologies. So yeah, I was talking about blogging at the time of my transplant, and I think that's the point probably where you got cut off. And the build up to the transplant, where I started a blog really so that patients and so family and friends could find out what it was going to be like going through transplant. That blog, I didn't realize was being read by my transplant team to really understand what it was like to be a patient going through a journey where you had 50-50 survival rate. And they shared it with their students, and it became part of understanding, what protocols were going to be like and needed to be set in building towards and post transplant. But the power really of the blog was that, as I look back now 5 years on, 6 patients have successfully undergone intestinal transplant as a result of them and their medical teams reading this blog online, that they didn't even know the procedure existed. And coming out of transplant, my surgeon at the time said to me, "You're going to need to keep coming back for routine visits." And I was like, "Well, it's 90 minutes to get here. To see you for 5 minutes to tell me I'm okay, what's the point?" And he was very clear. He said, "Fine, how else do you want to do it?" And I said, "Well, let's do it via Skype." He said, "Okay." So we set up a Skype link together, and we went into a multidisciplinary team meeting. 4 other members of the team were there, and he pressed go, and they walked out the room. And they said, "You can't share patient data on Skype. You can't talk on a video call. It's ridiculous." So he went home. We had a nice chat from his front room. And 2 years after that first call, Skype calls became part and parcel of treatment for patients. Because think of how many of us actually have to travel 5 minutes for possibly a routine appointment, when we have technology that we use in everyday life that we don't utilize in healthcare. My surgeon, as I mentioned earlier, is now in Chennai in India, and we use WhatsApp to communicate. But we now start to use a number of other tools that I do in my everyday life, really to manage my healthcare. And some of you may well have heard of a movement that came out of the US called We Are Not Waiting. It's a hashtag, We Are Not Waiting. And it's really a group of patients that have started to take control of their lives digitally. One of the early founders of it was actually a Parkinson's patient, a lady called Sarah Rigari in Sweden, who really was part of the first quantified self movement of patients who track their symptoms using apps and tools. And she only sees her doctor for 2 hours a year as a maximum. Dana Lewis, a diabetes patient who built an artificial pancreas that Medtronic now use as part and parcel of their terms. So there are a number of patients like me around the world using everyday tools to try and live our lives. One little anecdote to that and how we share things. My surgeon said to me, "You're always on Twitter. We want to be on Twitter. Set me up." And we did. Set him up with a Twitter handle. He wanted to be known as Surgeon X. And I said, "Okay, now you've got the hang of it. Next time I get my blood results, can you direct message me them?" So yeah, problem at all. Direct message me my blood results. Instead, he didn't direct message them. He sent my blood results out to the whole Twitter sphere. And the trust had a sharp intake of breath. This data is being shared everywhere. The truth is, I didn't care. I had the best conversation about my health ever, because suddenly I had surgeons from all around the world going, "You really need to look at his potassium level. You should check his magnesium level. And I think he needs these bloods and those bloods." And as you talk more deeply when I'm asleep about data, I would just throw this out there. I'm a long-term patient with multiple chronic conditions, a real pain in the ass to the healthcare system, and a huge cost burden. I will share any element of my data with anybody if it's going to give me a better quality of life and going to give me access to treatment that will keep me alive longer. I worry sometimes that the data and the privacy conversation is a Daily Mail headline, and a vocal minority perhaps aren't actually in positions like myself where actually we will do anything to get a better quality of treatment. So perhaps you want to bear that in mind in future discussions about it. So that's how I live my life as a patient. Right now, I use WhatsApp, I use text messaging, I use Skype, Hangouts. all Facebook Messenger to interact with my medical team, which allows me to travel and be anywhere I want to be and still get real-time care from my medical team. It saves them time and money, and it keeps me out of trouble on a daily basis. And I just question why, in this age of digital technology, when we're building apps and we're building amazing tools and amazing engines, why we don't actually use everyday tools in healthcare. Because as Dom pointed out in the previous talk, it's got to be brilliant and it's got to be excellent. And sometimes there are tools in our everyday life that are brilliant and are excellent and just part and parcel of our daily lives that we don't tend to use. Why not? When I woke up from transplant, the first thing I remember was touching my stomach and feeling a bag attached to my body. As part of transplant, I'd been given a stoma. I'm sure many of you know that's when the bowel is brought to the outside of your body and the waste is collected in a bag. And those bags frustratingly leak and they spill, and not the most pleasant things to have to deal with. And on top of that, your nurses and doctors come in and go, how much crap's come out today? Have you measured that output? Because we need to know gut functionality and how are you coping with it. And I used to lie in bed and watch the nurses empty, walk down the corridor with my output in a jug, throw it in the sluice, occasionally, if time permitted, enter that data onto the patient records, and fluid balance was all over the place. And the truth is, I just assumed there'd be a better quality of life for me. So I did what every patient does. I went out to social media and said, what do you guys do now that when you have a stoma? And engaged with about 20,000 patients around the world, all of whom basically said, just get used to this life. And the truth is, I didn't really want to get used to it. My surgeon had given me a gift of another life, and I wanted to live my life. So I turned to eBay and YouTube, and whilst in hospital, was lucky enough to hack together a sensor that at the time I was very proud of. It contained a flexible sensor strip that I nicked from the inside of a Nintendo Wii glove, a BlackBerry battery, and a few bits of kit that I was able to cobble together, and sellotape this sensor onto my bag and walk up and down the ward and say to the doctors, look, my bag's beeping now as it's filling. And my doctors, whilst humouring me, went, that's absolutely fine, but it's of no relevance to me. I still need to know how much is coming out and when. So we need to go back and redesign this. And that goes back to Dominic's point about starting with the end user. I've been privileged over the years to work at Stanford with Medicine X, which is a digital health lab there. And the model of care that we look at through the lens is everyone included. And everyone included basically is underpinned by mutual trust, mutual respect, but basically says you don't build digital tools unless everybody that's going to interact with them is part and parcel of the design and the development from the word go. And in my case, as I was looking to build a sensor for me, I realized very quickly it had to interact with the nurse. It had to interact with the clinician. I wanted it to interact with the medical record, so I needed technology input. And actually was only able to really build or take a hack and turn it into a product when I understood the power of how important it was to engage with every end user. And I wonder and reflect how many other industries would actually build something without engaging the end user. Tesla Motors, now one of the most sold cars in the world, end user built. Would Amazon, would eBay, would all these big companies, would Google have started if it wasn't thinking about what was right for the end user? But somehow in healthcare, we forget about that. Now, I'm very lucky. From that hack in a hospital bed in Oxford, I was able to build a device that now is CE marked. It's a class 1 medical device in the UK. It's FDA cleared here in the States. And we're currently interacting with about 30 hospitals around the US. And we're still, through ethics approval, to conduct our clinical trials in the UK. But that's fine. It's coming soon. It's only taken 2.5 years. So we will get there. My end thought, because I appreciate you're staring at a screen of a picture of me and probably want to go on to some more interesting things. My end thoughts are this about technologies. I'm privileged. I'm a patient who's engaged with technologies. I have a clinical team that allow me to use them every day, and I built a company that now delivers data off a bag, turns a dumb bag to a smart bag, and delivers real-time interventions. But the reality is for this to scale, it's not the technology that needs to change; it's the culture that needs to change. It's that human-to-human interaction. I'm a great believer that we have the schools, we have the skills, we have brilliant minds. We've just heard about DeepMind out there who can deliver solutions for patients like me. What we don't seem to have in the UK at the moment is that culture change, that mindset change that says, yes, I'm willing to do it. That statistic of only 2% of patients digitally engaged with the NHS is staggering when we have 80 to 85% of our population on smartphones. Why is that? It's not technology. I would argue it's culture change. And on that note, I will leave you. Thank you so much for bearing with me today with the technology challenges. And thank you for allowing me to be a small part of this conference.